What if I told you that what you do in the 2 hours before bed could be quietly destroying your brain, setting you up for a stroke you never saw coming? After age 60, your stroke risk doubles every decade. But here's what doctors aren't telling you. It's not just what you eat or how much you exercise. It's what you're doing tonight, in the comfort of your own home, that could trigger a deadly blood clot in your brain. I'm going to reveal 5 seemingly harmless nighttime habits that are secretly sabotaging your heart health and increasing your stroke risk by up to 300%. And chances are, you're doing at least 3 of them right now. Stay with me until the end, because habit number 5 is so common, so innocent-looking, that 8 out of 10 people over 60 do it every single night without realizing they're playing Russian roulette with their brain. Before we dive in, let me explain why this matters so much. Every year, over 795,000 people in the United States have a stroke. That's one person every 40 seconds. And here's the shocking part. About 87% of these strokes are ischemic strokes, caused by blood clots that form during the night when you're supposedly resting and recovering. The research is clear. Your nighttime routine has a massive impact on your cardiovascular health. Studies published in the Journal of the American Heart Association show that certain evening behaviors can increase blood pressure, promote inflammation, and create the perfect conditions for dangerous clots to form while you sleep. What makes this even more critical after 60 is that your blood vessels become less elastic. Your blood naturally becomes stickier, and your body's ability to break down clots overnight diminishes significantly. But here's the good news. Small changes to your evening routine can dramatically reduce your risk. So, let's get into these 5 dangerous habits, starting with number 1. Habit number 1. Eating heavy meals within 3 hours of bedtime. Picture this. It's 9 p.m., you're watching TV, and you decide to have a snack. Maybe it's a bowl of ice cream, some cheese and crackers, or leftover pizza. Seems harmless, right? Wrong. When you eat late at night, especially heavy, fatty, or high-sodium foods, you trigger a cascade of events that puts your heart and brain at serious risk. First, your blood sugar spikes dramatically. After 60, your body's ability to process glucose slows down significantly, especially at night. This blood sugar surge causes inflammation in your blood vessels and makes your blood platelets stickier, which means they're more likely to clump together and form dangerous clots that aim for your brain. Second, your blood pressure rises. Research from Columbia University found that people who eat within 3 hours of bedtime have significantly higher nighttime blood pressure levels. This is especially dangerous because nighttime hypertension is one of the strongest predictors of stroke risk, even stronger than daytime blood pressure. Third, late-night eating disrupts your circadian rhythm, which controls everything from hormone production to blood vessel repair. When you eat late, you're essentially telling your body to stay in active mode when it should be in repair mode. This means your blood vessels don't get the overnight maintenance they desperately need. A groundbreaking study in the European Heart Journal followed over 21,000 people and found that those who ate their largest meal after 9 p.m. had a 28% higher risk of stroke compared to those who finished eating by 7 p.m. But here's what makes this even more dangerous after 60. Your digestive system slows down as you age. That late-night snack sits in your stomach for hours, causing acid reflux, which not only disrupts your sleep, but also triggers stress hormones that further increase blood pressure and heart rate throughout the night. The solution? Implement the 3-hour rule. Finish your last meal or substantial snack at least 3 hours before bedtime. If you absolutely need something, stick to a small portion of nuts, a piece of fruit, or a cup of herbal tea. Your brain will thank you.
Habit number 2. That nightly glass of wine or nightcap. I know what you're thinking, but my doctor said a glass of red wine is good for my heart. Let me explain why that advice doesn't apply to drinking before bed, especially after 60. Many people use alcohol as a sleep aid. You might have a glass of wine with dinner or a whiskey before bed to help you relax. And yes, alcohol does make you feel drowsy initially, but here's the devastating truth about what it's doing to your stroke risk. When you drink alcohol before bed, it acts as a powerful dehydrator. It suppresses a hormone called vasopressin, which helps your body retain water. This means throughout the night, you're losing fluids through increased urination and breathing. By morning, your blood has become significantly thicker and more concentrated. Think of it like this. Imagine trying to pump honey through a straw versus water. That's what your heart is dealing with when your blood becomes dehydrated and thick. This dramatically increases the risk of clot formation. A landmark study in the journal Stroke examined over 14,000 participants and found that people who consumed alcohol within 2 hours of bedtime had a 74% higher risk of hemorrhagic stroke and a 39% higher risk of ischemic stroke compared to those who stopped drinking earlier in the evening. But the problems don't stop there. Alcohol causes what's called rebound hypertension. Here's how it works. Initially, alcohol lowers your blood pressure slightly. This is why you feel relaxed. But as your body metabolizes the alcohol during the night, usually around 3 to 5 a.m., your blood pressure shoots up dramatically, often higher than it was before you drank. This is why most strokes occur in the early morning hours, between 4 a.m. and 7 a.m. Your blood pressure is surging, your blood is thick from dehydration, and your body is in the most vulnerable state. Additionally, alcohol disrupts your sleep architecture. While it might help you fall asleep faster, it prevents you from reaching the deep, restorative stages of sleep where your brain clears out toxins and your blood vessels repair themselves. This is particularly critical after 60, when your brain's natural cleaning system is already less efficient. And here's something most people don't know. Alcohol interferes with your medication. If you're taking blood pressure medication, blood thinners, or cholesterol drugs, evening alcohol consumption can either amplify or reduce their effectiveness, creating unpredictable and dangerous variations in your treatment. The solution? If you enjoy alcohol, have it earlier in the day, preferably with lunch or an early dinner, and never within 4 hours of bedtime. Stay well hydrated by drinking water between alcoholic beverages and never exceed 1 drink if you're a woman or 2 if you're a man. Better yet, consider non-alcoholic alternatives like herbal tea or sparkling water with a splash of fruit juice for your evening relaxation ritual.
Habit number 3. Inconsistent medication timing or skipping nighttime doses. This one might surprise you because it seems so obvious, but it's one of the most common and deadly mistakes people make. And I'm not just talking about forgetting to take your pills occasionally, I'm talking about the timing of when you take them. Let me share a sobering statistic. Research shows that nearly 50% of people over 60 don't take their blood pressure medication at the optimal time, and about 30% admit to skipping doses when they feel fine. Here's why this is so dangerous. Your cardiovascular system operates on a 24-hour cycle. Your blood pressure doesn't stay constant throughout the day. It typically dips during sleep and rises sharply in the early morning, usually between 6 and 8 a.m. This morning surge is when most heart attacks and strokes occur. A groundbreaking study published in the European Heart Journal tracked over 19,000 patients with high blood pressure and found something remarkable. Those who took their blood pressure medication at bedtime had a 45% lower risk of stroke, a 42% lower risk of heart attack, and a 66% lower risk of cardiovascular death compared to those who took the same medication in the morning. Why? Because taking your medication at night provides maximum protection during those critical morning hours when your blood pressure naturally surges and stroke risk peaks. But here's where people make deadly mistakes. You're tired, you're ready for bed, and you think, I'll just take it in the morning. Or you feel perfectly fine and think, I don't really need it tonight. Or maybe you've had a glass of wine and you know you're not supposed to mix it with medication, so you skip it. Each of these scenarios is dangerous. When you skip even one dose of blood pressure medication, your blood pressure can spike by 20 to 30 points within 24 hours. When you skip blood thinners, your clotting risk increases immediately. When you take medications at inconsistent times, you create peaks and valleys in drug levels that can actually be more dangerous than not taking them at all. And here's something crucial that most people don't understand. You can't feel high blood pressure. You can't feel the early stages of a clot forming. The absence of symptoms doesn't mean absence of danger. Your body doesn't send you a warning signal before a stroke. The warning is the stroke. There's also the problem of medication interactions. Maybe you take 5 different medications. You're not sure which ones to take at night, which ones to take with food, which ones to take on an empty stomach, so you guess or you cluster them all together at once because it's easier to remember. The solution? First, talk to your doctor or pharmacist about the optimal timing for each of your medications. Many people are surprised to learn they should be taking certain medications at bedtime. Second, use a pill organizer and set a daily alarm on your phone. Make it part of your bedtime routine, as automatic as brushing your teeth. Third, never skip a dose because you feel fine or because you've had alcohol. If you're concerned about interactions, call your pharmacist immediately, but don't just skip it. Your life literally depends on consistency.
Habit number 4. Extended evening sitting and binge watching before bed. This is probably the most common habit on this list, and it's absolutely devastating for your stroke risk. Picture this. You finish dinner around 6 or 7 p.m., then you settle into your favorite chair or couch for the evening. Maybe you're watching the news, catching up on your favorite shows, or scrolling through your tablet. Hours pass. Before you know it, it's 10 or 11 p.m., and you've barely moved for 4 or 5 hours straight. Sound familiar? You're not alone. The average American over 60 spends more than 9 hours per day sitting, with most of that occurring in the evening, and it's killing us. Here's what happens to your body during prolonged sitting, especially in the evening. Your blood flow slows dramatically. When you're sitting, particularly with your legs bent, blood pools in your lower extremities. Your leg muscles, which normally act like pumps to push blood back up to your heart, are completely inactive. A study published in the Journal of the American Heart Association found that every additional hour of TV watching after dinner increases stroke risk by 7%. That means if you're sitting for 4 hours after dinner, you're increasing your stroke risk by nearly 30% compared to someone who stays more active in the evening. But it gets worse. When blood pools in your legs, it becomes stagnant. Stagnant blood clots more easily. This is why long flights are dangerous for blood clots, and the same principle applies to your evening couch session. The risk is even higher if you cross your legs, which compresses veins and restricts blood flow even further. After 60, your circulation is already compromised. Your vessels are less elastic, your heart doesn't pump as efficiently, and your blood is naturally thicker. When you add prolonged sitting to this equation, you're creating the perfect storm for clot formation. And here's something most people don't realize. The damage from evening sitting can't be undone by morning exercise. A groundbreaking study found that even people who exercised regularly still had elevated stroke risk if they sat for long periods in the evening. The timing matters. There's also the psychological component. When you're binge-watching TV or scrolling through devices, you're likely encountering stressful content. Whether it's disturbing news, dramatic shows, or anxiety-inducing social media. This stress triggers cortisol and adrenaline release, which raises your blood pressure and heart rate right when they should be winding down for sleep. The blue light from screens is another factor. It suppresses melatonin production, which not only affects your sleep, but also affects your blood pressure regulation overnight. Studies show that blue light exposure before bed can keep your blood pressure elevated for hours into your sleep.
The solution? Implement the 30-minute rule. Never sit for more than 30 minutes without standing up and moving for at least 2 to 3 minutes. Set a timer if you need to. During commercial breaks or between episodes, stand up and walk around your house. Better yet, do some gentle stretches or march in place. After dinner, take a 15 to 20-minute walk, even if it's just around your house or yard. This single habit can reduce your stroke risk by up to 40%. And here's a bonus tip. Stop all screen time at least 1 hour before bed. Read a physical book, do a puzzle, or listen to calming music instead. Your brain and blood vessels will thank you.
And now we've reached habit number 5, ignoring poor sleep quality and sleep apnea symptoms. This is the habit I mentioned at the beginning, the one that 8 out of 10 people over 60 are guilty of. And it might be the most dangerous of all, because it affects you for 6 to 8 hours every single night. Here's the scenario. You go to bed at a reasonable time, you're in bed for 8 hours, but you wake up exhausted. You snore loudly. Your partner says you stop breathing during the night. You wake up with headaches. You're drowsy during the day. You wake up multiple times to use the bathroom. You chalk it all up to just getting older, and you do nothing about it. This is catastrophically dangerous. Let me explain why. Sleep apnea affects approximately 80% of people over 60, but less than 20% are diagnosed and treated. During sleep apnea, your airway collapses repeatedly throughout the night, cutting off oxygen to your brain sometimes hundreds of times. Each time this happens, your body goes into emergency mode. Your blood pressure spikes dramatically, sometimes by 50 or 60 points, as your body desperately tries to wake you up to breathe. Your heart rate becomes erratic, your blood oxygen levels plummet, stress hormones flood your system. This happens over and over and over, all night long. A comprehensive study published in the American Journal of Respiratory and Critical Care Medicine found that people with untreated sleep apnea have a 300% increased risk of stroke compared to those without sleep apnea. 300%. That's not a typo. But even if you don't have full-blown sleep apnea, poor sleep quality is devastating for stroke risk. When you don't get enough deep sleep, your brain can't perform its nightly maintenance. There's a waste removal system in your brain called the glymphatic system that only functions during deep sleep. It clears out toxins, repairs damaged cells, and maintains blood vessel health. When you're not getting quality sleep, this system doesn't work properly. Toxins accumulate, inflammation builds up in your blood vessels, and your stroke risk climbs with each poor night of sleep. Research from Harvard Medical School tracked over 70,000 women and found that those who slept less than 5 hours per night had a 70% higher stroke risk than those who got 7 to 8 hours. And critically, it wasn't just about quantity. Those who reported poor sleep quality, even if they were in bed for 8 hours, had similarly elevated risk. Poor sleep also disrupts your blood sugar regulation, increases inflammation throughout your body, raises your resting blood pressure, and interferes with your body's ability to regulate blood clotting factors. And here's what makes this particularly insidious after 60. Many common medications actually worsen sleep quality. Diuretics make you wake up to urinate. Beta blockers can cause nightmares and restless sleep. Pain medications can suppress deep sleep stages. But most people never connect their poor sleep to their medications or think to discuss it with their doctor. The most common mistake people make is using over-the-counter sleep aids or alcohol to force themselves to sleep. These don't provide quality sleep. They sedate you, which is completely different from natural restorative sleep. You might be unconscious for 8 hours, but your brain isn't going through the proper sleep cycles it needs to repair itself and protect itself. The solution? First, if you snore loudly, gasp for air during sleep, or wake up exhausted despite spending enough time in bed, talk to your doctor about a sleep study immediately.
Sleep apnea is treatable, and treatment can reduce your stroke risk by up to 80%. Second, practice good sleep hygiene. Keep your bedroom cool, around 65 to 68 degrees. Make it completely dark. Use white noise if needed. Avoid screens for at least an hour before bed. Stick to a consistent sleep schedule, even on weekends. Third, review your medications with your doctor. Sometimes a simple adjustment in timing or dosage can dramatically improve sleep quality. Fourth, if you're waking up to urinate multiple times, stop drinking fluids 2 hours before bed, and definitely avoid alcohol and caffeine after 2 p.m. Don't accept poor sleep as inevitable. It's not just affecting your quality of life, it's literally threatening your survival.
So there you have it. 5 nighttime habits that are secretly increasing your stroke risk after 60. Number 1. Eating heavy meals within 3 hours of bedtime, which spikes your blood sugar and blood pressure right when they should be dropping. Number 2. Drinking alcohol before bed, which dehydrates you and causes dangerous blood pressure spikes in the early morning hours. Number 3. Inconsistent medication timing or skipping doses, which creates dangerous gaps in your protection during those critical morning hours when strokes are most likely to occur. Number 4. Prolonged evening sitting and screen time, which slows your circulation, pools blood in your legs, and disrupts your sleep hormones. And number 5. Ignoring poor sleep quality and sleep apnea, which subjects your brain and blood vessels to hundreds of dangerous stress episodes every single night. Now, I know this might feel overwhelming. You might be thinking, I'm doing all of these things. Am I doomed? Absolutely not. Here's the incredible news. Your body is remarkably resilient, and when you change these habits, you can see dramatic improvements in as little as 2 weeks. Studies show that when people over 60 modify their evening routines to address these 5 habits, their stroke risk can drop by 50% or more within just a few months. Your blood pressure improves, your blood becomes less sticky, your sleep quality increases, your brain's natural repair systems start working properly again. You don't have to change everything at once. Pick one habit this week. Maybe it's the 3-hour eating rule. Next week, add another, maybe cutting out evening alcohol. The week after that, set up your medication routine. Small, consistent changes compound into life-saving results. And please, if you recognize symptoms of sleep apnea in yourself or your partner, don't wait. Make an appointment with your doctor this week. Getting diagnosed and treated for sleep apnea alone can reduce your stroke risk more than almost any medication. I also want you to share this video with someone you love who's over 60. Most people don't know that their evening habits are the problem. They're focusing on diet and exercise during the day while unwittingly sabotaging their health every night. You could literally save a life by sharing this information. Remember, stroke isn't inevitable. It's not just bad luck. In most cases, it's the result of daily habits that accumulate over time. And that means it's preventable. You have the power to protect your brain, to preserve your independence, and to be there for the people who need you. Before you go, I want to hear from you. Which of these 5 habits are you going to change first? Drop a comment below and let me know. And if you've already experienced a stroke or have a loved one who has, share what warning signs you wish you'd known about. Your story could help someone else. If you found this video helpful, please hit that like button and subscribe to the channel. We post new videos every week about evidence-based health strategies for people over 60. Click the notification bell so you never miss a video that could change your life. Thank you so much for watching. Take care of yourself tonight, and I'll see you in the next video. Stay healthy, stay informed, and most importantly, get a good night's sleep.